I was transplanted at age 7, 1989, and everything went great. That first transplant was donated to me by my dad because he was a good match. I actually have a rare blood type, and just so happened he had it too. That it was a good experience. Dr. Hodge was a great doctor. He explained everything to my parents perfectly, and made sure that they were comfortable with everything that would be going on. I have to say the hospital actually went out of its way to make that first transplant a good experience. Getting from the first transplant to the second transplant, basically that kidney lasted from age 7 until age 26, which is above average. So it lasted a long time, but eventually it did wear out, and I went on dialysis at age 26. But eventually, I come to a place where I knew, okay, I can't stay on dialysis. I've got to make a transition, and that means another transplant. I knew that they had done me a good job the first time, and I was comfortable with the hospital, just like as far as laid out and everything, and I was comfortable with the people here. So eventually I decided that, okay, I'm going to pursue the second transplant here. I had excellent care through going through the into the operating room, all the pre-op and all that. I can't complain about any of that. Everybody was very professional, knew what they were doing, and that's very much a comfort to the patient's experience, because it's a scary situation, but it helps if you feel like that the people around you know what they're doing and are also kind, and that they genuinely care. It was actually pretty amazing. I have to say, there was a nurse that was working in recovery that was my original transplant nurse at the first transplant. But man, I was sure glad she was there too, because I didn't have my mom at that point, but I had somebody that I knew from the first one. It would have been rougher had I not had a good team, and I had a good team, and that just made the experience better.